Well, good morning and welcome to South Australia's daily COVID update. Today I'm joined by Stephen Wade, the Minister for Health and Wellbeing, Professor Nicholas Berry, the Chief Public Health Officer, and Commissioner Grant Stevens, also the State Coordinator during this major emergency declaration. I know that this has been a very challenging time for the people of South Australia, but we have avoided a catastrophic situation in our state by following the unequivocal health advice. The consequences of not acting quickly and following that health advice would have been absolutely catastrophic on all businesses, families and individuals in our state. And in a few moments' time, Professor Nicholas Berry will be going through some of the modelling that we were relying on for our response to this particular cluster. I know that many South Australians would be absolutely delighted that the stay-at-home order has now been released. This was taken off as of midnight last night, but I do need to emphasise that we still do have high-level restrictions in place over and above where we were at this time last week. They're going to be in place through to the 1st of December, so we need people to listen, know those restrictions and abide by them very strictly through to the 1st of December and any restrictions that might be in place thereafter. I've got to say that we are still not out of the woods. The good news is that the testing rates in South Australia have been phenomenal, more than 77,000 tests this week. And in fact, yesterday alone, we had 16,928. So this is a fantastic result. And the good news is there has been no community transmission whatsoever. And in fact, we have the EpiLink, or the known link, for every single case in this cluster. In fact, we have the known link of every case going right back to April of this year. So that will be great news for our Chief Public Health Officer, but also the other Chief Health Officers around Australia, and important information for them when they're deciding on their border arrangements with our state. Can I finally just say how absolutely proud I am of every single South Australian. I know that this week they've had to endure a lot, and whilst we have been physically distanced, I don't think we've ever been more united. And so a massive thank you to the people of South Australia who continue to work together, and their collective effort has meant that we have been able to stare down this very difficult situation. I'm now going to pass over to Professor Nicholas Berry for the statistics for today and some information on the modelling with this cluster.
Thank you and good morning. So I'll just give you an update on cases, and we have one new case today, but this is nothing to be concerned about. This is just a slight distraction in that it is an overseas traveller, so nothing to do with the Parafield cluster, but a female in her 20s who's in quarantine in a Medi hotel. And interestingly, she became symptomatic around day 10. So whilst we have some short incubation periods of less than 24 hours, in this case it was around day 10, which is exactly why we have a 14-day incubation period and a 14-day quarantine period. So that was not linked to the Parafield cluster. So in terms of our Parafield cluster, we still have 26 cases, so no new cases, and I'm really, really pleased, despite that high level of testing, and we're doing a rolling cycle of retesting and any close contacts, so we're picking things up very quickly. So that's good news. Also, just one hospitalised person, so everybody has remained stable, and that person in hospital is a male in his 30s. Now, I thought I'd give you an update on our contact tracing, because whilst most of the state has been a bit quiet and have been in that pause and have been on standby really for the 3 days, what my team in CDCB have done, and in fact our whole department and including SAPOL, we've been working around the clock to test, track and trace, to do that important contact tracing. And not only have we got the initial close contacts, but we are also focusing on getting every identifiable contact of close contact into quarantine as well, so that double sandbagging. And I'd call this a supercharged contact tracing or contact tracing on steroids. You have no idea the number of people that are in our department all focusing on phoning people and doing that contact tracing. So if you do get an SMS from somebody in our department to say you've been identified, can you please go into quarantine, and we'll have someone phoning you, please follow those instructions because this is a pretty critical time for us in South Australia to make sure that we're locking all of those end parts of these chains down. So we now have over 4,500 close contacts, or contacts of those close contacts in quarantine directly linked to this cluster, and that was a week after we had our first case. So a phenomenal effort, and I'd like to thank everybody in the health department, but also everybody in SAPOL for all of the work that has been done. So cases and testing stats, there's 37 active cases in our state with 555 total cases. As the Premier said, we have had a phenomenal amount of testing done with nearly 17,000 tests in total yesterday, both in our public and private labs. Now, just a word of warning, you might be hearing the weather out there. Some of our testing sites are located outside, and there may be an interruption to that testing because of the weather and safety for people. But I urge you to have a look online and see if there's a disruption, and then make alternative arrangements or go and get tested later in the day. But if you have woken up, anyone in South Australia, with a bit of a sore throat, runny nose, very mild symptoms, just feeling a bit off, please get tested today. Get tested on the day of symptoms. Now, I just will give you a little bit of an update on some more information about the particular cluster. And there's certainly quite a large number of settings, upwards in the high 20s, settings that we're working through with the settings owners and following up with many families, workplaces and public venues. So I also ask South Australians to look at our website, particularly now that we've got those restrictions lifted and we've got cafes, restaurants and other places open today. Please have a look at the website before you go out, and if you can identify that you are in any of our places of concern, please stay at home and follow the instructions. So don't just think, look, I'm going to go out. Please, everybody, have a look at our website. So in terms of the Woodville Pizza Bar, we've now got 21 close contacts and all staff have been interviewed and isolated, as well as many family members. And also there were 4 people that went into a Medi hotel last evening, and we're doing obviously testing for all of those people as well, and I haven't got those results back yet. We're still sending SMS messages through to people that have been patrons, so have got pizzas at the Woodville Pizza Bar. If you get a message, an SMS message, please follow the instructions. Now, Brompton Anglicare, of course, the most vulnerable setting of all in this cluster, the aged care facility. We've had a 3rd round of testing now, and that has shown no cases at all. So that will be a relief to all of the family and friends of all of the people and residents in that facility, because that's been in lockdown. And we're, of course, very hopeful that we have avoided any infections in that very vulnerable community. The Lowell McEwen Hospital, that was impacted both from their emergency department but also some of their mental health services, and there's been upwards of 250 patients interviewed or in the process of being interviewed, referred for testing, and we're onto a retesting phase for all of the involved staff. So lots of work still happening around the clock for us in the department. Now, I wanted to share for you, I've taken you on a bit of a journey over the last couple of days around the decision making and why this strategy has been unique to South Australia, and it was really because we were in a unique situation of being very early on in this second wave, and we had an opportunity of stopping it in its tracks. I had a range of information available to me at the time, but I also had some modelling that was done, and over the whole pandemic, way back as far as January, February, we've been very lucky as members of AHPPC and the other chief health officers to have a very strong relationship with a number of key mathematical modellers. And so a set of models was done for me and for our state last Wednesday. And one of the things that I was provided with was what's called the reproduction number. And our reproduction number, which was a theoretical number, had been sitting at about 1.3 for South Australia for a reasonable period of time. And that was based on Google Map data, surveys of people about how compliant they'd been within physical distancing and the like, and also some Facebook information. And that had been sitting at about 1.3. And what that means is that any one person was going to pass it on to about at least one other person, if not more than one other person. So an R above 1 means that an epidemic can take off. So because we actually had cases last week, I was given a number, an estimated number, well, a real number based on our numbers here of the reproduction number, and that was sitting well above 2, and it could have been as high as 4. So that meant to me that every one of our case had passed it on to at least 2 other people, if not 4 other people. And in fact, at that time, and based on that information, we had a 99% chance that the wave that was starting off in South Australia was not going to be just a little blip, but it was going to be a very significant wave. So a 99% chance based on those initial cases. Now I have got a graph here that I wanted to show you as well, and this is called a forecast model. And basically it shows a forecast of how the virus would spread if we hadn't made the decision to close down and basically supercharge our contact tracing. So it wasn't just closing down and telling most people in South Australia to stay away from others for that period of time, but at the same time we had to absolutely ramp up our contact tracing, and that's what we've done. Now the darkest blue band at the bottom where you can see, so you can see we've got our numbers here where we first had our cases, but then you've got that dark blue band. And what that shows is that there was a 50% chance that the epidemic would have grown somewhere in this band. And as you can see, with the dates on there, with 100 daily cases somewhere in mid-December, and with Christmas not far away, this was not something I felt we should be allowing to happen in South Australia. We had come too far to allow this just to take off like this. Now you might be wondering what those paler bands are, basically it shows a smaller but not a negligible chance that we could have had even a higher caseload, so upwards of 200 cases per day by mid-December. Now this is this is modelling, and we only had a small number of cases, so there's a great degree of uncertainty in this. But what we can say is that we had we were looking at facing a second wave here, and I thought that people would appreciate seeing some of that modelling that I was privy to middle of last week. So finally, as I'm winding up, I just have some further important advice for all South Australians. So what we've done is, as you know, everyone stayed at home, and we've done the contact tracing. We've got lots of people in quarantine. But if this has leaked out further, and we have tried not to let that happen obviously, but if it has, it's going to be this week and the week after where we start to see other cases pop up in the community. Now, of course, I'm hoping that's not going to happen. But this is absolutely why you need to heed these messages. Even though we've now got restaurants, cafes and other places open, everybody has to be COVID safe. People need to remember that basic hand hygiene. You must stay 1.5 metres away from other people that you don't know. And if you cannot maintain that, for example, you're in a supermarket or at a market. My husband was off to the market this morning, and I said to him, you need to be wearing a mask. So I'm encouraging all South Australians to wear masks if they can't physically distance. It is not mandatory, but I know when we've asked people in South Australia to do these sorts of things before, we've had such wonderful cooperation. It's a bit inconvenient wearing a mask, but you get used to it. Please don't feel like you look silly. If we're all wearing masks, we're all going to look the same. So the other really important message, and we've all been saying this morning, if you have any mild symptoms, you must get tested. That's the way we'll pick up if there is any community transmission out there. People who have some vulnerability, so chronic health conditions such as asthma, cardiac failure, or you're in an older age group, just try and reduce the amount that you're out and about at the moment until we're really sure this is over with. Try and stay at home as much as you can. I know it's difficult to do that for long periods of time. You're the sort of people that you should be wearing masks, and hopefully those are fairly readily available now in our community. Whilst most of the community now, the hard lockdown is over, the final thing I'll say is there is a very large number of people in quarantine in South Australia. Those people must fulfil their 14 days quarantine period. Of course, our staff will be in constant contact with you about that. So thank you very much, and happy to take some questions.
Professor, no new cases today linked to the Parafield cluster. How confident are you that you've prevented this outbreak from spreading further?
I will only be able to say I'm fully confident in a couple of weeks, and that's because even with all the work that South Australians themselves have done and all the work that SAPOL and the Department have done and Health have done, there's still a chance that there could be somebody in our community who has contracted the disease. So after a couple of weeks I will feel more confident, but certainly every day we go without cases is a good day. Just to be mindful, however, I'm actually expecting to have some cases of people in quarantine, and as long as they're in quarantine, then that's not an issue.
Is that modelling based on the fact that potentially the virus had spread through a surface like a pizza box?
No, this is based on, no. So that was not put into the model. This is a standard model that we've been using all year. It had our cases put into it, and it took into account other characteristics of the South Australian population.
Professor Spore, Labor's come out today to say that they want Medi hotels and international flights suspended until we can come up with a safe solution. What's your view on that?
Look, on the face value, there are, people will come up with other solutions in terms of Medi hotels. But what I can say is over the period of time we've had Medi hotels, we've had very, very few cases where we've had people becoming infected within the Medi hotel system. What has happened, what has changed, is that the risk has increased, and that's because there are very high rates of disease now in many of the countries people are coming from. So that means we do need to continue to look at the system that we have here, and as I've explained to you over the last couple of weeks, that is absolutely what we've been doing in South Australia, as indeed have other states.
Professor, how many suspected cases are there right now? You mentioned for us to expect more cases in the coming days. How many do you believe are positive but haven't shown it in the tests? Oh,
look, really that's too difficult to tell. We've obviously got our first ring of close contacts are the most likely, and we reported somebody who was the partner of a known case yesterday. So it's going to be over this next couple of days because of the incubation period that we may start to see more cases. Also, in those particular people, we're doing a lot of retesting.
You mentioned just the other day, 2 days ago I believe it was, that you said there were 44 suspected cases. Is that number lower now?
Look, I'm not going to use that term. I won't keep using that term because it is confusing. Our department or communicable disease branch often have been using the term suspected case for close contacts, but it also refers to people who have symptoms but have a negative test result to start with. So I think that's probably just muddies the water a little bit. It's useful for us in our department in terms of tracking how we're going, but we certainly feel that we've got majority of close contacts and many of the contacts of close contacts now in quarantine.
Professor, with that Labor's comments this morning in regards to that change to the Medi hotels, what do you think some of the alternatives could be that could be implemented? Do you agree that they may have to be moved out of capital cities and to less populated areas?
Well, one of our challenges in South Australia for less populated areas is it also means we could potentially be co-locating this risk near Aboriginal communities, and that is really an unacceptable risk in my mind. So you then have to think through all of the logistics of getting resources and food, and also for us in terms of getting testing and staff there. I think on face value it would be very, very difficult. I think our Medi hotels have been very strong in terms of their overall functioning and their performance. We know that from the Holton review. I'm actually quite comfortable with having the Medi hotels as they currently stand.
Professor, you mentioned yesterday that there were 40 families that hadn't made direct contact with SA Health. Have any of them reached out after yesterday?
Yeah, so I had an update from the department yesterday, and they had got nearly everybody now, so that was good news for me.
Professor, moving forward into this working week and beyond now, this seems like you guys have got a sense of achievement after what you've done. What is the messaging on masks and hygiene and social distancing?
Absolutely. As I just said, this is the week where we will start to pick up if indeed there has been any community transmission. The way we can stop that and slow that down, which doesn't have an impact on our economy and on our businesses, is us all practicing hygiene with our hand hygiene, cough etiquette. If you cough, you do it into your elbow and get your hands washed again. Any symptoms, you must get tested. And if you can't maintain 1.5 metres, and 1.5 metres is quite a distance, you're going to start getting a sore throat talking to people at 1.5 metres, which is what happens to me frequently. But if you can't maintain that 1.5 metres, I urge you all to wear a mask.
Professor, 77,000 tests done this week. I mean, how happy are you with the level of compliance South Australians are showing?
Oh, absolutely stoked. I have just always felt very privileged to work in South Australia and to be doing this job, because whenever we have asked people, could you possibly do this? Could you do this for us? They have just done it, not just 100%, they've done it 150%.
Just on this modelling, is this different to the modelling of the first wave, or the so-called first wave? Was this spreading differently or quicker?
No, I can't really answer that precisely, but what I can say is it's using the same modelling assumptions as we had when we had the first wave modelled.
Just lastly, what do you say to people who might have thought that authorities did jump too quickly based on this so-called one lie? And that this modelling might be sort of, I suppose, explaining maybe around that. What do you say to people? Is this modelling really what would have happened without this one lie?
Look, I have no regrets on my advice and decision making last week. I feel very confident that it was the right thing to do. When you work in medicine, you don't just take one piece of information. You take a range of information and you put it together. And that's, I guess, what my training has been, has to be able to put all of those bits of information together and then provide what I believe is the best advice at the time. And so this was another bit of the information that I had, as well as, of course, the information from interviews, also knowing that we were very, very early at the start of this second wave.
Professor, when will QR codes and ID scanners be getting rolled out? And if the Woodville Pizza Bar had had a QR code, would that have helped this situation at all?
We are very close to having that system in place here in South Australia, and I might pass over to the Minister to perhaps make a few more comments, but the QR code and the scan tech are very useful in situations where you've got large numbers of people. So for particularly in pubs, clubs, those high-risk venues, and indeed places such as the Adelaide Oval or some of those larger events. Of course, any venue that does have that QR reader ability is helpful. One of the things that will be we will be ensuring when we bring this in, and it's very close to completion, is it's no point having the venue or the business holding that data, because it still takes a considerable amount of time for us to get hold of the data and then to use that. The system we're intending to have in South Australia is that the data comes in real time and sits within the government. It's deleted after 28 days, but it means that CDCB and the contact tracers can access that data when they need it, rather than waiting and then having to go down the track and do it later.
Commissioner, could I ask you a question?
Just the new task force that's been established, is there any update on their investigation at all?
It's Just for a point of clarification, we have Task Force Protect, which is investigating the circumstances around the Woodville pizza shop, and we have another dedicated crew of investigators which make up, in addition to detectives, we have digital forensic experts, intelligence officers and analysts supporting the contact tracing efforts more broadly. So that's working directly with Professor Spurrier's contact tracing team. Task Force Protect is still obviously conducting its investigation. I can advise, I have had a full briefing this morning from both teams. The individual at the centre of the Woodville pizza shop was spoken to yesterday. Further inquiries are being conducted. We have seized some electronic devices from that person and they're being analysed as well. And I anticipate that Assistant Commissioner Peter Harvey will be in a position to give a more comprehensive briefing about the status of the investigation tomorrow.
Have you managed to speak to those two other persons of interest you mentioned yesterday?
Not at this time. I understand that they are two of the 4 people that have been taken into hotel quarantine, so clearly that's part of the investigation process.
Did they come forward willingly, or did you track
I
them
don't have
down?
that information.
Just with yesterday, how many fines were issued, if any, and was there any issue prior to midnight with maybe some businesses opening up just before the clock struck midnight?
Now, I believe there were somewhere in the order of about 182 expiations for official warnings given out to people over the course of the last 2 days, and somewhere in the order of about 103 fines were given. And I'll just stress that the fines issued were for people who were blatantly disregarding the directions. We also acknowledge the fact that people were starting to modify their behaviour based on the anticipated changes as of midnight last night. I have to say that I was able to get out and have a bit of a look around, and even right up until like 6:30, 7 o'clock at night, people were still generally abiding by the stay-at-home direction, which we're very pleased with. Virtually all businesses were doing the same thing. Some businesses did request staff to go in so they were in a position to commence operations at midnight. We essentially made that concession that was an appropriate course of action for those businesses. There won't be any sanctions for those. Most people have done the right thing, and when you think about the number of expiations for warnings and fines being in the order of about 280, in a population of 1.7 million people, not that we are checking every single person, I think that's a testament to the fact that everybody has made a genuine effort to do the right thing, and we're very grateful for that.
Commissioner, with this investigation into the Woodville pizza bar, can the public help in any way?
If there is any opportunity for the public to assist, then that call will go out, and I'm sure Assistant Commissioner Harvey will make that call if that's a requirement to progress our investigations.
Commissioner, are you able to tell us a little bit more about the scanning and the ID checking systems that could be coming in? Are they going to be mandatory for places like bars, clubs, hospitality venues?
Some venues, it will be a mandatory requirement for the venue to have the QR code available, and they will be able to access that QR code by updating their COVID Safe Plan on the sa.gov.au site, and when they print the COVID Safe Plan it will come with their QR code, which they can replicate and put across their premises as much as they like, but it will be mandatory for that, and we will be requiring people to scan as they go through. We're acknowledging that some people don't have mobile phones, so we're looking at other mechanisms to capture that data as well. It's important to stress that there will be other businesses that will be given the opportunity to voluntarily download QR codes, and there are going to be certain interactions with the community, and I suppose a good example is fast food drive-thrus, where the interactions that may be of concern from a contact tracing point of view simply can't be captured that way.
Are there any other for the Commissioner before we move on? No.
New South Wales this morning, the government are asking for a third of their hotel quarantines to actually go to skilled workers and to university students to start getting some foreigners back in. Is that something that you would support in South Australia?
I'm not quite sure of the situation in New South Wales, but what I know is that we've been prudent with the number of beds that we believe that we can support in South Australia. We take the health advice and SA police advice, and that is what we act on.
Can I ask you as well about your thoughts on Labor's proposal to suspend the Medi hotels and international flights?
I'm very disappointed with Peter Malinauskas and the Labor Party. This seems an extraordinary departure from what has up until this point in time been very bipartisan. From a logistics point of view, it makes no sense whatsoever. We don't have 1,200 rooms in Woomera on Christmas Island to pop up with a quarantine hotel, let alone the staff, let alone building of a hospital alongside it. This seems to be something which has had very little detail consideration before presentation. But more than that, I think it undermines the public health experts that we have here in South Australia. And at a time when I think South Australia has never been more united, I think this is just a blatant attempt, quite frankly, at pushing fear and division. What we need at the moment is people working together. I quite frankly find it disgusting that Peter Malinauskas thinks that South Australians returning from overseas, or those returning from Victoria to do their quarantine, should be put in a detention-style quarantine centre on Christmas Island or Woomera.
Is it really fair to say that he's undermining you, though? This is the first time he's come out with something that's going against the grain.
Look, I think that this is just very, very blatantly designed to undermine what we have here in South Australia. We've had excellent public health experts advise our courses of action right since day one. We've got very, very good systems. I mean, where does Peter Malinauskas think we're going to find the workforce in remote South Australia or Christmas Island? And why does he think it acceptable for people, South Australians, thousands of South Australians who have returned home during using this methodology, should be stuck on a detention centre style arrangement?
Premier, is the government looking at moving a Medi-Hotel quarantine to Woodside Army Barracks?
I'll tell you what we're doing. We're listening to the health experts. They have guided us. No is the answer, but just to go on from that, because you might have another 16 other locations that you want to go through, but I'll be very clear. Right from day one, our approach in South Australia has been to listen to the experts, back the experts, and act promptly to keep South Australia safe and our economy strong. It's worked particularly well to date, and we're not changing our position. What Peter Malinauskas has done is to jump on a bandwagon, deliberately undermining the health experts in South Australia, and essentially saying we don't want anybody coming back until South Australians are sent out to Woomera or Christmas Island in a detention centre style arrangement. Well, quite frankly, I find this disgusting.
Premier, today this modelling gives the sense that we have achieved something here in South Australia. There have been thousands of business owners who don't feel like winners today because of the actions that this government's taken. What is your message to them?
Look, my message is we now have very clear advice that if we didn't act promptly, there would have been catastrophic consequences for businesses in South Australia. I fully appreciate just how inconvenient and how costly this is for some businesses. But the alternative was absolutely catastrophic. We had a 3-day significant interruption in South Australia. Victoria had 112 days. I could see the visible relief on people's faces on Friday when they knew that they could get out and exercise. That was after 1.5 days. You imagine being locked up for 112 days. So we had one chance to stay in front of this cluster. The expert health advice was very, very clear. We acted upon that immediately, and we, I think, are in a good position. We're not out of the woods yet, and it's very important to emphasise that. There are still a large number of people who are in quarantine who will need to fulfil their full 14 days of quarantine. There may be some other remnants of this cluster out in the community. So that's why it is absolutely crucial, especially over the next 2 weeks, that anybody who develops any symptoms whatsoever goes off and gets themselves tested. But what I can say is how proud I feel of South Australians who have gone out and stood in line, sometimes for hours, to get themselves tested so that they're part of our overall response to this very dangerous situation.
Premier, what do you say to people who might say that this modelling has been wheeled out just in time to justify the shutdown?
Well, let's be very clear, this modelling was done earlier in the week. It was done by the same people who have done the work for the AHPPC right since day one. We thought it was important to explain to people just exactly and precisely what that danger was. But this is not modelling that's been done after the event. This is modelling that was presented to us before we made the decision to go into this arrangement.
Do you have any idea how much this might have cost?
Guarantees that if another person comes along and lies again and provides false information, that it will be picked up before such drastic action like a lockdown occurs?
Let's be clear though, the modelling that we've seen today shows very clearly, and no part of that model was developed based upon the person going going into a pizza bar. So this is exactly and precisely the situation that we've had in South Australia. We've been able to get on top of this very, very quickly. Yesterday, Professor Spurrier could demonstrate why we knew we got onto this very quickly. We had a once-off opportunity to stay in front of this cluster. Now, I think that we have taken the right course of action, and as I stated yesterday, if I was presented with the same information again tomorrow, I'd do exactly the same thing, because my primary responsibility and the responsibility of this government is to keep the people of South Australia safe.
Do you have any idea how much this shutdown might have cost businesses? Have you done any modelling yet to work that out?
No, but what I also know is that not taking swift action would have had catastrophic consequences on every business, every family, every individual in the state.
Premier, what's the advice for, particularly for people in regional areas who are travelling interstate, someone who may be going to Queensland in the coming days? Adelaide is seen as a hotspot by that government. What's your advice to them? If they hop on a plane in Adelaide, are they now in the hotspot? Yeah, I guess could we clarify that for them?
So look, we know that certain states have made decisions regarding their declaration for travel into and out of South Australia. I think what we'll see is that normalise in the coming days. As I stated very clearly, we have no example of community transmission in South Australia. Every single one of the infections that we have can be traced back to source. So this gives people that exist in that public health setting great confidence that we've got on top of this cluster just in time. But we'll see that over the coming weeks. What we would like to see in South Australia is us go back to where we were this time last week by the 1st of December, including opening up our borders with Victoria.
So at this stage,
I know that you've said obviously that the modelling is there and that you would have done everything the same, but just going back to people lying and providing false information, again, what guarantees or what sort of systems are in place to ensure that that won't happen again and that it'll be picked up sooner?
Well, look, we haven't had this situation before, and as the Police Commissioner has stated, we are doing a thorough investigation into that evidence, that false and misleading evidence that was provided to the Communicable Diseases Control Branch. But let's not jump the gun. Let's find out exactly and precisely what has happened, and we'll have a full report in a very short period of time. We know that the South Australia Police have dedicated significant resources to getting to the bottom of this as quickly as possible. We know the people of South Australia deserve an explanation, and we're working as quickly as we can to get that explanation.
It's been about 200 days, or I think the last outbreak before this was in April. Why has it taken all of this time for the South Australian government to establish QR codes? Couldn't that be done in a matter of weeks?
So we take our advice from the health experts. We have a different arrangement that they have in other states, and we believe that the if you like, the precautions that we took in South Australia were commensurate with the risk. When we said that we were looking to have stand-up consumption, that we would need to put the QR codes and the scanner tech in place at the same time. That was due to occur actually at the end of this week. But because of this outbreak, we have delayed that, and so we believe that QR technology will come in place the first week of December.
Premier, on the man that was untruthful to contact tracers yesterday, you said, I'd like there to be consequences. How realistic is that, given his visa expires mid-December, he's not an Australian? What are the chances of this man facing any kind of penalty?
Well, what I'm keen to do is to get this investigation completed so that we have a full transparency of exactly all and any false and misleading information, not just from the person at the Stanford, but other people who might not have been providing the evidence that we needed. It's really super important during a pandemic that public health administrators charged with the unenviable responsibility of taking quite often some very drastic action are given accurate information. In this case, they weren't, and so I do think there needs to be consequences, and we will look at what some of those could be, either under the Emergency Management Act, the Public Health Act, the Criminal Law Consolidation Act, and but we do need to find out exactly and precisely what has taken place before we can apply those acts.
So you're just saying that there's more than one person that's lied. You've just implied that there's multiple people who didn't tell the truth.
Well, we've got an investigation to establish that, but I think people have already been asking questions about why co-workers didn't identify this person, and why also The pizza bar itself didn't identify this person as an employee. Now, these could have been just anomalies, but that's why we have an investigation to get to the bottom of this.
Premier, where are things at with the
investigation, and community backlash has been huge online. Is there anything being done to monitor this man's mental health to make sure we don't have a extremely traumatic outcome?
Absolutely. In my daily briefing with the leadership team, I've been assured that people are monitoring that situation.
Premier, where are things at with the hotel quarantine review, particularly around workers having a second job? Do you have an update on that?
Yes, well, look, as you would be aware, we moved very quickly on Monday. We were the first state in Australia to put mandatory 7-day testing in place. In fact, we wouldn't have found out about the person at Stanford if we didn't put that changed arrangement in place. We've always said that we have got a good system, but we will always look at opportunities to improve that. But we take our advice on that from SA Health. They will be doing an investigation.
Where are things at with the review of the hotel quarantine system and around workers having a second job?
So, as I was saying, we will have a review of this situation. We'll take that advice from SA Health. They've kept South Australia safe right throughout this pandemic, and I have every confidence that if there's any needs for any other changes to the arrangements, then we will be provided with that. We certainly haven't been provided with advice to do all of our hotel quarantine work on Christmas Island or in Woomera. That makes no sense whatsoever. We'll keep getting our advice from SA Health, who have done an outstanding job right throughout this pandemic.
So, Premier, can I just confirm, is there a review currently being undertaken by your government into the hotel quarantine system off the back of what's happened this week?
Yep. So just to be really clear, because we've been through this in several press conferences this week, but I'm more than happy to go through it again because I know not every member of the press is the same every day. But every single incident, every single infection that we have in South Australia is the subject of an investigation. More broadly than that, because this is an emergency, under the Emergency Management Act, we conduct independent investigations. You would have just seen we've just received and responded to the Kilty report, which was into this situation which existed for the bushfires in South Australia. We've already responded to that. So there will be a review which is done at that individual level, as well as a larger review into this situation.
Do we have a time frame of that, when that might be carried out?
I'm happy to provide that detail for you.
Just on regional travel, what's the advice? Is it open slather, everyone can go, or you still, as the Commissioner said yesterday, would sort of advise people not to go unless you really had to?
Look, it's advice only. We're not saying to people they can't travel to regional South Australia, because many people have their own property that they would like to visit. They will have family members that they need to visit. They may have bookings already in place. But what we are asking in that situation for people to maintain good social distancing, good hand hygiene, and if any symptoms are developed, moving off very, very quickly to get themselves tested, and whilst they're awaiting that test result, they maintain isolation. So that's the situation, but we're certainly not advising for unnecessary travel at this stage to the country. We think that will change as of the 1st of December.
And how about our border reopenings with some of those other states, Queensland? Would you like to see them sort of lift now, especially before Christmas?
I'm very keen to see our border restrictions lift with other jurisdictions. I'm very pleased that we have normalised borders at the moment with New South Wales, the Northern Territory and the ACT. We'll be providing all of our information regarding these cases to Queensland, to Victoria, to Tasmania and to Western Australia. But I emphasise very strongly, there is no example of community transmission in South Australia. We have the epilink of every single one of our infections. So I'm very hopeful that we can open those borders very soon.
Just lastly, what does Christmas look like for South Australians? What are we going to be facing?
I think because of the incredible work of the people of South Australia over the last week, we will enjoy a very normal Christmas here in South Australia. It was looking very frightening earlier in the week. I think now it is looking very, very positive, but we're not out of the woods yet. We've still got some hard work over the next couple of weeks, but I feel very confident that the cooperation that we've seen from the people of South Australia will continue, and that we will have a fantastic Christmas here in South Australia.
Thank you.